Whooping cough is a global concern. From Europe to the Americas and Asia, pertussis continues to resurface in waves. So why are we seeing these resurgences? Waning immunity. Childhood protection wears off by adolescence, meaning teens and adults can spread pertussis unknowingly. Missed vaccines. The COVID-19 pandemic disrupted routine immunization worldwide, leaving gaps in coverage. Vaccine hesitancy. Misinformation has led some parents to delay or refuse vaccines. Global disparities. In low-income countries, limited access to vaccines means outbreaks remain persistent. Public health agencies are responding in several ways. Maternal vaccination campaigns, protecting newborns through mothers during pregnancy, booster programs. CDC and NHS recommend TAP boosters for adolescents and adults. Awareness drives, clear messaging to counter misinformation and remind families to keep vaccines up to date.